Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Welcome, this is Dr. Jacobs. In this video, I'm gonna go over how to diagnose sciatica. But before I do that, I will explain what is sciatica and what kind of test you can do at home to figure out if you potentially have sciatica nerve pain. So what is sciatica? Sciatica is a low back pain that usually radiated the pain to your thigh, your legs, and it goes down behind your buttock. And also you can see it here in this image that going from L4 to S3 of your spinal cord nerve. So the sciatica nerve comes from L4 to S3 of the back of your spine. This is the back here. This is your hips. And the nerve distribution usually comes from this area and goes down to the buttock, the thigh, and the leg, and distribute and help your body to have proper movement in your lower extremity and also give you some sensation. So when you have sciatica or low back pain that caused by something compressing on the nerve from either the back here, or through the buttock area, that could cause those symptoms of low back pain, numbness, tingling in the lower extremity. Also, you might lose some movement or you feel weaknesses in your foot, your ankle, or your knee. And it's common symptoms that patients complain of sharp shooting pain that going down from the buttock and hitting the back of the thigh or back of the leg area. With sciatica, usually the pain increase with movement and decrease with rest. And as you see here in this image, the sciatic nerves comes from L4 to S1 and distributing back to the buttock, the leg, and the thigh area. One of the tests that you can do at home to discover if you possibly have sciatica nerve pain is the slump test. And as you can see in this image, this is usually a passive test. You probably want someone to help you to lift your legs up. So basically, you're gonna bend your head with your trunk forward like this image, and someone gonna take your leg up straight upward like this in this image. And if you start to notice sharp shooting pain going down from your back to your lower extremity, that's a positive test. Usually you start with the side that does not have symptoms and do the opposite side. But if you start to have sharp shooting pain, there's high chance something compressing on the sciatic nerve and cause that sharp pain. The other test that can be done at home, but also you will need someone to help you with that test because this is a passive test too. So you lie on your back and have one leg, both legs are actually flat on the table, and someone need to come and help you to lift one of the legs up to 60 degrees. And if you start to notice sharp pain that's shooting down to your lower extremity, there is high chance you have sciatica. And the other variation of this test, while you are doing this, you need to flex your head forward. That's also cause more strain on the sciatic nerve that if you have any compression or lesion around the sciatic nerves, you will have symptoms. So those are the two tests we usually use in the clinical setting to see if patient is experiencing sciatica nerve. I'm including link below this video for the 7 surprising causes for sciatica pain. It's very important to know those causes so you will know what you should not do to cause or trigger sciatica pain. And also I will include 3 powerful treatments that effectively relieve and get rid of sciatica. If you have any question or comment, leave it in the comment section below and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.